Good evening and welcome to Carib Talk on iVision TV. I'm your host, Roxanne Bartley. Ivy's on vacation this week, but we're on location, bringing you the latest news and happenings throughout Florida and the Caribbean region. We'll bring you the latest on the crisis in Cuba with the cholera outbreak there, and bring in expert Jeff Benjamin to give us some insight. Kara will also bring us the second part of her fun trip to the Bahamas. Stay tuned. In 1886, Vicente Martinez Ybor moved his cigar-making operation to Ybor City in Tampa, attracted by better trade deals and transportation. Today, the Cuban influence has added a unique flavor to cuisine, arts, and customs throughout our city. Last year, Tampa International Airport celebrated the first U.S. direct flight to Havana. With a special visa, persons can now visit relatives they have not seen in a long time. Understandably, our local community is interested in what is going on in Cuba. Unfortunately, today the news of a cholera outbreak in the Granma province is causing concern. Through Saturday, 158 cases of cholera has been reported, nearly 3 times as many as previously disclosed, but there were no new deaths, and the outbreak appears to have been contained and is waning, says Cuba's Ministry of Health. Reports indicate that 3 elderly people have died from the disease, and cholera is suspected in 2 other cases. Prior to this outbreak, Cuba's last confirmed incidence of cholera was in 1959. We have joining us today Dr. Jeffrey Benjamin, the mayoral candidate for City of Miami 2013. Jeff is a motivational speaker, an author, a TV analyst, director of neurology EEG, and the author of the book Love and Cholera. Jeff, welcome. Most people in the U.S. have probably heard of cholera, much less experienced it. Can you tell us a little bit about this disease?
Well, cholera's been around since the 1800s when Dr. Snow in England really identified cholera. It really is an acute intestinal infection caused by the bacterium Vibrio cholerae. It's spread by drinking and eating contaminated food or water. And it includes raw shellfish and most undercooked fish. People who are infected don't show this symptom of cholera, which are usually mild to moderate diarrhea and vomiting. And this is the key to identifying when someone does have cholera.
Can you tell us then, obviously, if some people aren't aware, because they might mistake this for the common cold, if they just have diarrhea or vomiting, what are, in the more severe cases, what can people expect to see?
What are you expecting? You know, people may have a temperature and dehydration, severe dehydration. And the key with cholera is making sure that the patients or that someone who's infected is rehydrated. It's that watery stool that you find and that vomiting because you're losing fluids continuously. And there is a lot of treatments out there, intravenously, not by peel, what we call peel, by mouth. These antibiotics don't work, and they're generally in the classification of doxycycline, tetracycline, ciprofloxacin. They would have to be used intravenously in a hospital setting. Since cholera is usually in third world countries where they don't have access to healthcare like what we have in the U.S., what you want to do is identify your source of contamination. That is the key, identifying your source and having ample source of electrolytes back into your system. And we say, you know, in the medical field, we're thinking about 500 to 1,000 milliliters of fluid to rehydrate yourself per day. And that should, keeping yourself rehydrated optimally will help fight cholera. And, of course, washing your hands in your home, not spreading nosocomial infection. We don't want that. 20 to 50% of this infection takes place continuously in the home by your family members. And you always want to keep it, a vigilance about the transmission of, if you know someone who has cholera.
Sure. I know one of the things definitely seen in the past when we had this outbreak in Haiti and other places is the use of chlorine tablets. And I know that your point about, getting to the source of the contamination, I would imagine in those situations they're looking at contaminated water supply. So we've got the undercooked shellfish or fish, contaminated food or water. Is there anything else that folks may have to look out for?
And I'm going to go out on a limb here, and since, I believe accountability, and not to say that we're slamming anyone or we're trying to, hold people to a higher level, but accountability and patient education. Letting people know that there's an outbreak, identifying where the outbreak is so they don't use the contaminated source, sharing this information to the infected people in that community is the key. You have to give them the resources and the tools to help themselves. And so patient education is the number one underlying factor to prevent cholera.
Jeff, thank you so much for being with us. As we mentioned earlier, we know you're running for mayor in Miami next year. We hope that you'll come back and talk with us again soon, perhaps on a happier topic like that. But we appreciate your expert opinion on this, and we encourage everyone who may have traveled to the region to do as other health agencies have advised and follow basic food safety precautions, including frequent hand washing, avoiding food from street vendors, drinking bottled water, and so forth. And if you do feel ill, you start vomiting or diarrhea, given the outbreak, this may be a good time to seek clinical help. And in the meantime, we'll be keeping an eye on any weather patterns in the Caribbean that may have rainfall impact on the situation in Cuba and keep you posted.